If you are a principal and you've been informed by a parent or a staff member that someone is a confirmed case of COVID-19, the first thing you should do is be assured that all confirmed cases of COVID-19 are notified to the HSE, and the HSE undertakes the call systems to gather information from the confirmed case. That will identify that someone was in the educational facility that you're at, and that will come to public health and we will contact you. That contact usually happens the same day or sometimes the following day, depending when we are informed. So while you're waiting for public health to call you, there are a few things that you can do and get organised ready for that call. The first thing to note is that if a person is within the school setting, within the period within which they are infectious, then we will need to undertake a public health risk assessment with you. So that is if someone was in the school setting for 24 or 48 hours before they were diagnosed with COVID-19, depending on whether they had symptoms or not. If they were in that setting, we undertake the public health risk assessment and we will ask you lots of questions about your school, about the structure of your school, about the classrooms, the particular class that the teacher or the student was in and who they might have interacted with at close distance. So it is helpful to think in advance of the case where they might have been and what they might have been usually doing, and to have ready to explain the measures that have been implemented within the school to protect and prevent from further cases of COVID-19. You can also ensure that you have up-to-date information, names and dates of birth of the students within the class and the teachers who might have been associated with a case of COVID-19. So that information is ready for public health should they wish to have it for onward testing as close contacts. You are not expected to identify the close contacts yourself. That is done through public health and through the public health risk assessment. But having that information for the people who may well be included as close contacts will help speed things along once that public health risk assessment has occurred and get the testing organised for the children and staff required. So if it's determined after the public health risk assessment that there are close contacts who are recommended to have COVID-19 tests, the HSE will organise those. Whether it's one test or two tests, then the exact date of those will depend on what the public health doctors feel is appropriate, depending on when your last date of exposure is. So a date and recommended date will be organised and offered to you, and we do ask that you please attend your HSE-free coronavirus COVID-19 test appointment, and the results of that process will come through to us very rapidly, and you will have your result within 24 to 48 hours. There will also be, if there is any concerns or any delays for you, a dedicated point for principals to contact within the HSE to get the public health advice. So that will help if there are any particular concerns or any time constraints that you are under.